Welcome back, everyone, to the deep dive.
Great to be here.
You know the drill. We dive into stacks of sources, notes, all that stuff, and pull out, well, those nuggets of knowledge, the surprising bits, just for you.
Kind of like your shortcut to getting really informed.
Exactly. With hopefully enough interesting facts and maybe a little humor to keep you hooked.
That's right.
So today, we're doing something a bit different, a really unique deep dive, actually. We're looking at an element, bromine. But not through the usual lens of modern chemistry. We're sort of time traveling.
Right. We're looking at bromium. That's Bromium, as it was described way back in William Boericke's homeopathic Materia Medica.
In that context, the Materia Medica part is really crucial for what we're doing today, isn't it?
Absolutely. Because a Materia Medica, at least in this historical context, it isn't just a list of drugs. It's much more detailed, almost like an artistic collection.
Okay.
It's a collection of symptoms, characteristics, all observed and associated with one substance. Think of it like a portrait.
A portrait of the substance.
Exactly. A really comprehensive portrait painted through incredibly specific observations of how they believed it interacted with the human body, the human system.
So our mission today is to unpack this specific portrait, this picture of bromium.
Yeah, and try to understand what insights are actually in this historical record.
Exactly.
And maybe even, how they put together such a detailed picture in the first place.
Right, because honestly, some of the connections we're going to uncover are, well, pretty unexpected, really specific details.
Definitely.
We'll look at its main targets in the body, like its strong connection to the respiratory system.
Which comes up again and again.
Yeah. And then its effects on the mind, which are almost, theatrical, like this delusion about strange people looking over your shoulder.
It gets very specific.
Very specific. Mm-hmm. And we'll even look at the conditions that apparently made symptoms worse or surprisingly better. It's going to paint a really particular, maybe even counterintuitive picture.
It really is. A unique signature.
Okay, let's dive in. Let's unpack this bromium.
Let's do it.
So looking at Boericke's Materia Medica, the very first thing that jumps out about bromium is where its effects are strongest, especially in the larynx and the trachea, so deep in the respiratory system.
Right, that's central.
But it also highlights a specific type of person it seems to affect more. It mentions scrofulous children with enlarged glands.
Okay, let's break that down a bit. Scrofulous refers to kids who are prone to glandular swellings, often linked to a type of tuberculosis common back then.
Okay. And it also mentions blonde type individuals.
Yeah, and that hints at this whole idea of constitutional types, which was pretty common thinking.
The idea that physical characteristics were linked to certain, weaknesses or responses.
Exactly. Susceptibilities or how they might react to a remedy. It wasn't just enlarged glands either.
No,
the text says they have a tendency to infiltrate glands, become hard, but seldom suppurate.
meaning they didn't usually form pus, like an abscess.
Right. And that specific detail was really important for telling it apart from other remedies. It suggested a different kind of inflammation, maybe more like hardening, almost calcification, than an active infection.
That level of detail is incredible. And it really shows up when we look at the mind symptoms, too.
Oh, yeah?
The source describes this really peculiar delusion. It's an illusion that strange persons are looking over patient's shoulder and that she would see someone on her.
Wow. That's specific.
Isn't it? And also just a general quarrelsome disposition. It's not just physical stuff. It's like a personality sketch.
Well, and I think that tells us a lot about their whole approach.
How so?
It suggests that for the people putting these Materia Medicis together, a substance's effect wasn't just physical. It wasn't siloed. It acted, systemically. It showed up even in deep psychological states. This complete picture, the unique mix of physical, mental, emotional symptoms, that was the key.
The substance's signature.
Precisely. It allowed them to try and match it exactly to a patient whose own symptoms mirrored that specific pattern. The whole cures-like idea. They were mapping the illness as much as the substance.
Okay. Moving up to the head, the source mentions megrim of left side.
Which is an old term for a severe headache, often one-sided. Migraine, basically.
Right. And it gets worse with stooping, especially after drinking milk.
Specific triggers again?
Yeah. And headaches generally worse from the heat of the sun and rapid motion. Also, sharp pains through the eyes.
Okay.
And then this one, a sense of being dizzy when crossing a stream of water.
See, it's those kinds of things. Dizzy crossing water. How do you even document that?
I know. You have to wonder about the observation process there.
But those highly specific details, they're so intriguing. They clearly suggest, a heightened sensitivity to things in the environment or specific actions that maybe wouldn't seem obvious to us now.
But they meticulously recorded them as part of Bromium's pattern.
It just underscores the incredible patience and, frankly, observation skills these early researchers must have had.
Absolutely. Okay, the nose. It has its own set of peculiar symptoms, too.
Of course it does.
Corylusa, with corrosive soreness of nose.
Like a bad head cold. Very irritating.
And a distinct stoppage of the right nostril. Not just any nostril.
The specificity.
Yeah. Pressure at the root of the nose. And this feeling, tickling, smarting, as from cobwebs.
Wow, cobwebs. That's evocative.
Isn't it? And then an interesting one, bleeding from nose, relieving the chest.
Okay, that's a counterintuitive connection.
Right.
But it's a perfect example of how these texts mapped these complex interdependencies in the body's symptoms. It wasn't just isolated things.
It was the whole cascade.
Exactly. How one area could affect another. And it also mentions fan-like motion of Ale, the nostrils flaring.
Which points straight back to breathing difficulty, doesn't it?
Absolutely. It's building that respiratory theme for Bromium.
And speaking of that strong connection, the throat section notes a raw feeling in the evening with hoarseness.
Okay.
Tonsils that pain on swallowing, looking deep red with a network of dilated blood vessels.
So clear inflammation signs.
Yes. And tickling in the trachea during inspiration when breathing in.
Yeah.
And hoarseness that specifically comes on from being overheated.
Again, specific triggers and sensations.
But the respiratory system, like you said, is really where Bromium's signature seems to shine, according to this source.
It seems central.
It's mentioned for whooping cough, with a note to use persistently for about 10 days.
Interesting therapeutic note there.
It causes a dry cough with hoarseness and burning pain behind the sternum. Also, spasmodic cough with rattling of mucus in the larynx, which can be suffocating.
Sounds serious.
Yeah. Croup is mentioned specifically after feverish symptoms have gone down, and laryngeal diphtheria, where the membrane starts in the larynx and spreads up.
That deep, consistent focus on the respiratory tract really underscores Bromium's main area of action, its primary affinity.
Yeah.
And that description of a cold sensation when inspiring, when breathing in,
Yeah.
that's particularly vivid, very unique.
It really paints a picture.
It offers a specific sensory detail that would help tell it apart from other conditions, other remedies. And the point about asthma, too,
What was that?
it notes difficulty in getting air into lung. Not out, but in.
Ah.
And that highlights the specificity of its action. They differentiated it from other substances, like chlorum, which might affect breathing out. This level of meticulous differentiation is what makes these texts so fascinating.
Okay, here's where it gets really interesting. I find this detail almost poetic. For asthma,
Yeah.
the source says it's better at sea of seafaring men when they come on land.
Wow. That's a remarkable environmental modifier.
Isn't it? Better at sea, but worse for sailors once they're back on shore.
That's incredibly specific.
It also notes hypertrophy of heart from gymnastics.
An enlarged heart from physical exertion.
Right. And fibrinous bronchitis with great dyspnoea, difficulty breathing. The bronchial tubes can even feel filled with smoke.
These situational things, like being better at sea or the link to gymnastics, they provide crucial context.
How so?
They illustrate this idea that the substance's effect isn't just about the body part. It's about the whole person's response to their environment, their activities.
Right. Finding that precise, maybe even idiosyncratic pattern.
Exactly. That defined Bromium's influence. It paints a picture of a substance that's deeply tied into the individual's unique circumstances.
Okay. The text then goes into specific male and female symptoms. For men, swelling of testicles, which are indurated, hardened, with pains worse from slight jar.
Okay, sensitivity to impact.
And for women, swelling of ovaries. Menses that are too early and too profuse, with membranous shreds.
Specific characteristics there.
And a low-spirited feeling before menses. It also mentions tumors in breasts with stitching pains, worse left.
Worse on the left side. Again, that laterality.
And sharp-shooting pain in left breast, worse pressure.
So these details, down to which side is affected or the type of pain, stitching, shooting, it's all part of building that unique symptom picture.
To tell it apart from other things.
Exactly. It helps differentiate it from other substances that might cause similar general issues. This level of precision, that was their diagnostic tool. It let them really fine-tune their choice of remedy.
Sleep is also affected. The person is full of dreams and anguish,
Okay, troubled sleep.
experiences jerking and starting during sleep, and is full of fantasy and illusions.
Well, quite disruptive.
Yeah, finds it difficult to go to sleep at night, but then cannot sleep enough in the morning and wakes up trembling and weak.
That sounds exhausting.
It does. Then the skin. Bromium shows up as acne, pimples, and pustules, also boils on arms and face.
Okay.
And critically, it refers back to the glands again. Notes them as stony, hard, especially on lower jaw and throat, and mentions hard goiter.
Ah, see? That consistency. The description of hard, stony glands comes up again.
From the introduction right through to the skin section.
It really reinforces that core characteristic of bromium's action, that tendency to cause induration, that hardening rather than suppuration, the pus formation.
It's like a common thread.
Exactly. A consistent thread running through its whole symptom picture, which must have made it highly recognizable to the practitioners using this system.
Okay, finally, the modalities. The conditions that make symptoms worse or better.
Right, these are often crucial.
Bromium symptoms are worse from evening until midnight.
Okay, time of day matters.
Worse when sitting in a warm room during warm, damp weather, when at rest and lying on the left side.
A lot of worse conditions there. So warmth, dampness, rest, left side.
But conversely, it's better from any motion, exercise. And going back to that asthma point, at sea.
Better from motion and exercise and at sea. These modalities, you could argue, are the most vital part of these kinds of texts.
Why is that?
They give the practical application. They identify the specific circumstances that make the patient feel worse or better.
Ah, the context.
Exactly. And that direct contradiction, worse in a warm room, but better with exercise, that highlights the often paradoxical nature of how its effects were observed.
Which is another key part of the picture.
It's all part of that incredibly specific blueprint they were trying to map out for each substance.
Wow. What an incredible deep dive that was into bromium. We've really explored its distinct personality, you could say, as Boericke laid it out.
Yeah, it definitely emerges with a strong affinity for the respiratory system, for glands.
Especially in those blonde type people and scrofulous children.
Right. And those really unusual, specific mental and physical symptoms we talked about.
It's truly remarkable when you stop and think about the sheer level of detailed observation needed.
Oh, absolutely. The dedication to recognizing patterns, to compile such a comprehensive symptom picture is just...
Wow. Every single detail, like that cold sensation when inspiring, or the delusion about strange persons.
Or even left-sided mumps, which sometimes gets mentioned. Each little piece contributes to this unique, identifiable pattern, a distinct signature for bromium.
Yeah.
And it really highlights how this way of understanding a substance, it went so far beyond just its chemical properties.
Right. It focused on the entirety of its observed effects within a living system.
Exactly. Seeking that complete, holistic pattern.
So what does all this mean for you listening in?
Well, I think it encourages us to consider how these historical observations, no matter how, well, unusual or maybe even puzzling they seem to us now, they reveal this fascinating attempt to categorize and understand human illness through incredibly specific, sometimes really counterintuitive patterns.
That's a different way of looking.
It is. It invites you to maybe ponder how observing seemingly minor details, or even bizarre ones, and meticulously connecting them, how that can sometimes unlock a whole new understanding.
Whether it's a historical medical condition, or really any complex system or problem you might encounter in your own life. It's just a powerful reminder, I think, of the value of truly looking, truly listening, and connecting the dots.
Even when those dots seem really far apart at first glance.
Exactly. Fascinating stuff.